Today we're in the New Jersey office to talk about the 4 fittings that we find the most common, or at least the most important for our applications. The Unistrut catalog, if you've ever seen it, can be a little daunting, expansive. While there's plenty of options in there, we really think that if you focused on these 4 fittings, you're going to be able to accomplish most, if not anything, you're looking to do within the medical or data applications. So first, we're going to start with the P2346. This is commonly used in with a solid vertical. So this fitting could be used at the top and the bottom. This allows you to orient the vertical in any direction and rotate the fitting accordingly, so you could pick up your lower piece at the or at either end of the vertical, depending or regardless of the direction that it's actually pointed in. Secondly, we have the P1028 cross fitting. Typically, we'll use these for the bottom of our X-ray supports, so where our intermediate rail or secondary rail attaches to the finish rail. This allows you to obviously join 2 pieces running opposite or perpendicular to one another. Next, we have our 1047. Most commonly, you'll see those with a threaded rod drop application like this. This allows the rod to actually pass through the fitting and gives you a little window for fine-tuning height and adjustability. Then lastly, we have our P1068 or 90-degree fitting. We use that mostly for our diagonal brace applications. It really provides infinite flexibility and avoids having to miter any cuts to work with an angled fitting. So this really just gives you freedom to angle that brace wherever it needs to be, and it'll also put that diagonal brace out of plane, so you're not competing with other members or parts and pieces that might be in the way.